Welcome to your clinic. Today you are here for a consultation with your anesthesiologist regarding an upcoming delivery. Prior to this meeting, you received an information sheet that describes various anesthesia procedures. This sheet also includes explanations of the side effects and complications associated with these procedures. To start our conversation, I would like to ask you a few questions about your medical history. Let's begin. How tall are you in centimeters? How much do you weigh in kilograms? Do you have any allergies? If you have already given birth to children, did your deliveries go smoothly? Did you have an epidural anesthesia during a natural childbirth? Or did you have general anesthesia or spinal anesthesia during a cesarean section? Now about previous operations and anesthesia. Have you ever had an operation? If so, have you had general anesthesia? Or have you had local or regional anesthesia? Were there any complications during operations or anesthesia? If yes, then what kind of complications? Let's now come to the chronic illnesses. Do you have any illness of the cardiovascular system or the lungs? Do you have any illness of the gastrointestinal tract, the liver, or the kidneys? Do you have neurological disease of the brain or spinal cord? Do you suffer from diabetes or thyroid dysfunction? Do you have other diseases that we haven't talked about yet? Is there anyone in your family with a muscular dystrophy? This is a congenital muscle disease that is very rare. Now it's about medication. Do you take any medication regularly? Do you take aspirin or other anticoagulant medication, such as abdominal injections to prevent thrombosis? Have you ever had a thrombosis? Do you have major back problems or even herniated discs with movement and sensory disorders in your legs? Do you smoke? Are you taking illegal substances? Now we have finished the health questions. Next, I will explain to you the common anesthesia procedures in obstetric anesthesia. We can offer you the option to have an epidural catheter placed for a pain-free natural delivery. Whether this is performed or not is a decision you make during the course of birth giving and in cooperation with your midwife, who will accompany you during your stay. In our clinic, an anesthesiologist is always available and can come to you promptly to perform the procedure if you wish, anytime. Now, concerning the procedure. To place an epidural anesthesia, you will need to sit and round your back after local anesthesia, which may cause a slight burning sensation under the skin for a few seconds. A small plastic tube is inserted into your spine using a hollow needle. The puncture itself is not painful due to the local anesthesia, but it's important not to move during the procedure to avoid a headache, which is a possible side effect. The plastic tube remains in your back until delivery and will be periodically filled with local anesthetics to keep you pain-free during contractions. For a planned cesarean section, you should not eat anything, drink anything, or smoke in the 6 hours before the procedure. After preparation in the ward on the morning of the operation, you will be accompanied to the operating room. There we will provide you with an infusion access through which we can give you fluids and medication during the procedure. If you have a planned cesarean section, you will receive a spinal anesthesia. For this, while in a seated position and after local anesthesia to your lower back, a very thin needle, which you'll barely feel, is used to administer medication into your spine. You will quickly experience a warm sensation that rises to your abdomen. Your body will then be insensitive to surgical stimuli for approximately 1 to 2 hours. You will remain awake during the procedure and can receive your child immediately after the umbilical cord is cut. After the operation, you usually stay in our recovery room with your partner and child for 2 hours to be monitored. There we will check your vital parameters and pay attention to side effects and possible complications from surgery or anesthesia. You will receive pain therapy, anti-nausea medication, and we monitor, for example, for possible allergic reactions or bleeding complications. After your stay in the recovery room, you are taken back to your room and stay there until you have entirely recovered. If you notice movement disorders or sensory disturbances in your legs during the first few days after spinal anesthesia or epidural anesthesia, you should inform the nurse in charge of this. In rare cases, there are neurological deficits, which are then treated as quickly as possible and are usually reversible. Do you have any questions? For more detailed information, we refer you to the information brochure that you received before our conversation and which we will then sign together. Thank you for your attention and goodbye.